Hi, I'm Larry Nespoli with the New Jersey Council of County Colleges. At New Jersey's community colleges, we believe that our students, as well as all citizens, need to be informed about the important issues facing higher education. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus New Jersey has been provided by the New Jersey Education Association, the Robert Wood Johnson Foundation, Johnson & Johnson, Health Republic Insurance of New Jersey, County College of Morris, connecting learning and life, New Jersey Council of County Colleges, and by New Jersey Natural Gas, proud to support education in our communities. Promotional support provided by New Jersey Monthly, the magazine of the Garden State, available at newsstands, and by Commerce Magazine.
Hi, I'm Steve Adubato. The question is, what are we doing to deal with childhood obesity? The gentleman I'm about to introduce is working on it every day. He is Dr. Darrin Anderson, Deputy Director, New Jersey Partnership for Healthy Kids. Good to see you.
Thank you for having me today, Steve.
Let's talk about your organization. What do you do?
Well, the New Jersey Partnership for Healthy Kids is the state program office, funded by the Robert Wood Johnson Foundation and technical assistance provided by the New Jersey YMCA State Alliance. But we're mobilizing local and state partners to not only reverse the childhood obesity epidemic, but we're looking to about building a culture of health and creating healthy communities.
How bad is the obesity? How bad is the obesity problem with our kids?
Well, the obesity problem is detrimental at this point. I mean, we have children that we're estimating that will not live lives, longer than their parents. And in some communities, we have children, maybe 1 out of 2 children may be overweight. But the biggest issue is that the access to physical activity, the access to healthy eating, the access to health services, and those things that someone needs to reach their optimal health is just not, it's not existing.
You talk about the access to quality foods, the initiative called the Healthy Corner Store Initiative.
Yes.
What is it, and what impact is it having?
Well, the Healthy Corner Store Initiative is a collaboration between the New Jersey Partnership for Healthy Kids and as well as the Food Trust. And this initiative is really working with local businesses, working with state government, working with partners, working with the industry about best ways to promote and to increase the sales of healthy products within corner stores.
What do? You go right into, corner stores, bodegas, what do? You go in and you say?
Well, we have a couple of programs. Well, we don't necessarily go in and say,
You don't?
We don't, because many corner stores or owners, sometimes to a certain degree, have identified their needs. What we do is we go in and say, would you like to be part of a network?
You ask?
Yes, we always ask.
And ask what?
And we ask the question. The question is, what type of products are they interested in selling within their corner stores? And many times they want to carry fresh fruits and vegetables and carry poultry and milk. They just don't have the refrigeration. They don't have the equipment. They just don't have the resources that's needed.
How can you help them? They say, listen, we'd love to carry healthier choices, but we do not have the ability because we don't have refrigeration, whatever it is. How can you help them?
Well, through this particular program that we do have mini grants. And through the mini grants, what we try to do is work with them with their marketing and product placement and ensuring that if they have a certain percentage of their shelves that have unhealthy food, how can we change that ratio and to get the healthier products onto the shelves.
What about the whole refrigeration thing, though?
Well, the refrigeration thing, it really depends on the size of the store. I mean, there's a lot that goes into it. But at the end of the day, you want to be able to sustain the foods that they bring in, realizing that the demand is there because families do want to eat healthier. Families do want to have access to fresh fruits and vegetables. They do want to have milk that's 1% and 2% milk. But by having the refrigeration there, it gives them opportunity to have more sustainability and be able to keep it at least long term.
There are 5 communities in New Jersey that you're focused on. Which ones are they?
Well, we're focused on the city of Newark, New Brunswick, Trenton, Camden, and Vineland.
Why did you pick those?
Well, those communities wasn't chosen for some, unordained reason. It was chosen because, number one, communities of low income, number 2, communities of color, number 3, they had a prevalence of childhood obesity. So as we looked at the track and we began to project, we knew that those children were more vulnerable or more at risk in becoming adolescents or becoming adults that would be overweight.
You know, it's interesting. We've talked to the folks at the Robert Wood Johnson Foundation. They've been incredibly supportive for nonprofits, two nonprofits like yours, ours, and others. But we need to reiterate every time, in terms of public awareness, public education, people need to understand what these young people who are overweight, some cases dealing with obesity, what they are at risk for in terms of public health problems, medical problems, clinical problems. What are they at risk for?
Well, they're at risk that, you know, with heart disease, diabetes, you know, physical inactivity and healthy eating is one of those winnable battles. I mean, these are the battles that if families have the access and if families have the opportunities, you know, they will be able to indulge in healthy foods and be able to go out in a safe neighborhood and bike and walk within their community. So it's a challenge. And many times families don't have the options that's needed. You know, the environments in which they live in to a certain degree can be contaminated and toxic. You know, at one point, you know, I remember growing up, I had a goldfish and my brother had one. Well, anyhow, 2 days later, my goldfish was doing a backstroke. And I determined because of the environment, my brother fed his fish. He made sure he checked the pH, he checked the temperature of the water. He did everything he could to ensure that environment will allow that fish to reach its optimal potential of health. I didn't do that. So that's exactly the problem and the challenges that our children and families are going through in certain communities.
Think about this. You talk about physical activity. And again, the Y is a big partner here. We talk about the YMCA.
Yes.
Access to healthier food, big piece of this. Access to safe places where kids can be involved in physical activity is huge. Talk about that.
Absolutely. Well, our parks. You know, when was the last time that you driven through your community and you got a chance to see a plethora of children out in the parks, you know, running and playing and having a good time? I mean, unfortunately, many things that's taking place in our parks need to be, you know, we need to get rid of those things and bring back programming and bring back physical activity and bring back the opportunity for children to run around wild like we once did when we were younger. And the safety, you know, but also how do you get to the parks? You know, do we have sidewalks? Do we have bike lanes? Does the built environment support that?
And where's the role for law enforcement?
Well, I think there's a role for everyone. I think this is a particular issue. Well, you know,
hold on.
Yes.
Dealing with kids in terms of childhood obesity, particularly in these communities, urban communities, poor communities, that's everyone's issue?
Absolutely.
Because?
Because it's not a silver bullet. There's not a panacea that's out there. You know, one strategy will trump another strategy. We need local businesses. We need government. We need corporations. We need farmers. We need Department of Education, Department of Agriculture, Department of Health. We need everyone that's contributing to this issue and bringing their content expertise to the table so we can begin to address this collectively in an impactful way.
Finally, why does this matter to you so much?
Well, it becomes personal but also professional. First of all, you know, my father had type 1 diabetes. When we were growing up, I saw diabetes like a roaring lion. You know, my father had end-stage renal disease. My father had hypertension. Unfortunately, my father succumbed to a heart attack at the age of 57. So as I was growing up seeing this, you know, I kind of made a commitment to myself that not only do I want to be healthy, but I want to ensure that everyone around me is healthy. So I'm an advocate for this.
You're living it every day.
Trying to.
Well, I appreciate you coming in and being part of this discussion. Dr. Darrin Anderson, Deputy Director, New Jersey Partnership for Healthy Kids. We appreciate you being with us.
Okay, thank you for having me.
Keep up the fight. Stay right there. We will be back right after this.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
Hi, Steve Adubato. We're coming to you from the offices of the Robert Wood Johnson Foundation here in Princeton, New Jersey. We're here joined by our good friend, Dr. Josh Bershad, who is Senior Vice President and Chief Medical Officer, Robert Wood Johnson University Hospital. Good to see you, Doctor.
Good to see you, sir. How are you today?
Doing great. We're here at the foundation, so things are real good here in Princeton. Talk to us about hospital readmission rates and the fact that they're too high. Patients come back too often, and there is an initiative that your hospital has collaborated together with the foundation on to reduce the number of people who come back to hospitals, right, Josh?
Sure. So, Steve, one of the problems that people have talked about in the media and patients have experienced recently is patients that, what we say, bounce back and forth between the hospital and another setting. Another setting could be their house. It could be a rehabilitation facility, what we say is subacute, but a rehabilitation facility could be a nursing home. It could be a home care. It could be anywhere else. And they go home, and perhaps everything's not, all the T's are not crossed and the I's are not dotted. And there are things that we could do to help them have a better chance at staying at home and in good health. And so we've worked with the Robert Wood Johnson Foundation through their generous support on something what we called the Robert Wood Johnson Community Care Coordination Initiative.
Community Care Coordination Initiative. What's its goal?
Its goal is to improve community care coordination of resources, but we're measuring that by preventing readmissions to the hospital.
Give us an example of what is going on and what you're trying to stop in the process.
Sure. I always think the best way to look at this is if we take a patient.
Yep.
So if we take Mrs. Smith, is 60-something years old. She has a bunch of different health issues, and she goes home from the hospital. Let's say she was admitted because she had a heart attack. She goes home from the hospital. It's a scary time for a patient. Patient goes home. They're on a bunch of new medications. They might have a bunch of new physicians that they have to see after they're released from the hospital. And there's a lot of things that have to go right in order for them to stay home and to stay in good health. And sometimes those things just don't happen exactly. And the goal of this initiative was to affect people like Mrs. Smith and try and increase the chance that things go right. So make sure that, let's say in the old days, she went home and she had 7 new medications. So someone in her family or the patient themselves had to go to the pharmacy. They had to fill the medications. They had to make sure that the 3 medications that they were taking before they were in the hospital were the right ones, and they now matched with the other 7.
That's a lot, Josh.
It's a lot of medications. Now there's 10 medications. They have 2 new doctors they have to see, and they have to see them quickly. They have to call the offices. They have to get appointments. And there may be other things. They're supposed to start an exercise program. They're supposed to go to cardiac rehab. There's a bunch of different things that are complicated for a patient who, of course, is scared.
Right.
Patient's scared, they had a heart attack, they were in the hospital. This is all new to them. And so our job in this program is to make that whole transition process between the hospital and the home easier and safer.
How? And by the way, what has the foundation done to help Robert Wood Johnson University Hospital do this?
So the foundation gave us a financial grant, which we've used to do 2 things. I would say it was a 2-pronged attack. One is an information piece.
Information? What does that have to do with it?
So one of the challenges is what I described for Mrs. Smith, where multiple doctors, pharmacies, perhaps a cardiac rehab center, a hospital, and many other providers of care. They all have to see the information about what Mrs. Smith experienced, what happened to her. And that information is not always available easily. Sometimes it's on paper, sometimes it's electronic, but it's not connected. So one prong of our community care coordination initiative was to connect all these sources of information through technology. And so what we've done is we've connected over 675 physicians, 16 post-acute care facilities. In real terms, those are nursing homes, rehab centers, and others who are in the community.
And they're all connected. How?
Connected via something called Relay Health. Jersey Health Connect is an organization. There are many hospitals that participate in it, many physicians, many other providers. And so we've connected it so you can access the record of what happened to that patient.
So Mrs. Smith.
Mrs. Smith.
She's in this situation.
Yes.
How does that system of information help her deal with her situation?
So Mrs. Smith goes to see the cardiologist after she goes home from the hospital, goes to see the cardiologist. The cardiologist has a question about what some tests showed. The new cardiologist wasn't the person in the hospital. They could try and get the medical records in the old days. They'd call the hospital, they'd have to sign a bunch of paperwork. Complicated. This way they log on to the system, they pull up Mrs. Smith's case, and that information has been sent from the hospital to this big database, and they can look up Mrs. Smith's information. Now the doctor knows the answer to that test, makes a quick decision, much faster, much more efficient, much safer for the patient.
Does that, by itself, before you move to the second part of it, doctor, does that reduce the odds that Mrs. Smith will wind up back in the hospital?
It's a great question, Steve. I don't know the answer. We presumed that information flow was going to be one of the critical factors.
Right.
We all, as physicians and healthcare providers, experience this challenge all the time when we see a new patient. We never have all the information we would like to have. And so we made the assumption that helping to solve that problem would help prevent readmissions. I don't know the proof of whether that piece...
We don't have enough data yet.
Correct.
Got it. Give me the other part of it.
The other piece of it was that Mrs. Smith also is scared, has all these new medications, has different things in her home. Maybe she needs to be on a low-salt diet. She goes home and she doesn't have the support. So the second piece is what we call transitional care.
Transitional care. Transitioning from the hospital to?
Next setting.
Got it.
Whatever it may be. And so what we're doing is we're sending a nurse into the house, into Mrs. Smith's home. with her permission. And what that person will do is sit down at the dining room table, take all the old medicines and the new medicines, and make sure that Mrs. Smith is taking the right medicines now. They'll make sure that Mrs. Smith has that appointment that she's supposed to have with the cardiologist or her primary care doc or somebody else. They'll make sure that she has an appointment that she's going to go. They may call that provider and make sure that they have the information that they need, and perhaps get them signed up for the electronic network that we talked about if they're not. So again, now Mrs. Smith has a much greater chance of taking the correct medications, attending her appointments that are needed, getting to cardiac rehab. They might look at the food in her pantry with her permission and say, hey, you know, this is really high salt food. You know, let's talk about how you could have a better diet that would support you.
But Josh, the thing that is striking me about this, in the time we have left, you told me before we did this interview offline, that one of the things you want to make sure is that nurses and other healthcare professionals are working to the scope. What did you say?
I said the highest scope of their life.
What does that mean?
Sure. So I think one of our challenges for the entire healthcare system is that everybody at any level of training does the highest level of work that they can do. For example, a nurse may be able to do many things that are done by a nurse practitioner or a physician today. And so we want that nurse to do it. One, that spreads resources. It makes more people available. One of the things we're going to do with this grant is we're going to experiment with something called Grand Aides. Grand Aides. So Grand Aides are a group of people who have less training than a nurse, but there's some research to support that they could do this transitional care process the same way a nurse does.
Is this less expensive too, which would then potentially reduce the cost of healthcare overall?
Exactly. It is a less expensive alternative, and it would free up nurses to do work that only a nurse could do. More efficient. More efficient.
And potentially reduce the readmission rate for patients going back into the hospital.
Yes, that's correct. With a less expensive resource. With a less expensive
And that is what this grant is helping to do from the Robert Wood Johnson Foundation.
It's one of the aspects of the grant. We're going to try it as a pilot in the middle of this grant.
And could potentially have implications across this country.
Yes. Others have studied this. Arthur Garson is the leader in this field. He's Dr. Arthur Garson from UVA. He's the leader. And there's some research to support that this is a technique we should try. And so we're going to try it here in New Jersey with our patients and see if we can improve upon those outcomes.
Fascinating pilot. We are pleased to be joined by our good friend, Dr. Josh Bershad, Senior Vice President and Chief Medical Officer, Robert Wood Johnson University Hospital. Thank you, Josh. We are, in fact, coming to you from the offices of the Robert Wood Johnson Foundation. I want to thank you for joining us. Thanks, Josh. We'll be back right after this.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
Gerry Agyeman is a teacher at Parsons Elementary School. It's an honor to have you. This is part of our collaborative partnership with the NJEA, the New Jersey Education Association, Classroom Close-Up.
That's right.
You were featured in that, right?
Yes, sir.
We're about to see that package. By the way, set this up for us. This is a Parsons pre-K summer program?
That's correct. So what you're about to see is really what we do over the summer for the past 3 years. And that's provide education for 5 weeks to families who wouldn't otherwise get preschool because of, financial background and timing. So we give these kids the most effectively planned education within 5 weeks for them to be prepared for kindergarten in September.
Because pre-K is so important.
Yes, sir. Yes, sir. It's so important. And the fact that pre-K is not mandated, and not even kindergarten in New Jersey is mandated itself. So getting this early start is so important. And so we want to make sure that everybody sees this.
That's why we're going to show you this great video from our partners at the NJEA, Classroom Close-Up, Parsons Pre-K Summer Program. Let's take a look.
Morning, boys and girls.
Good morning.
Please start doing your mystery question. Look at the word and pick what word pattern it has. For the last few years, the children have been coming to kindergarten not prepared. They didn't know their names. They couldn't find their names. They couldn't write their name. They didn't know the difference between a letter and a number, what the letters are. They didn't know how to cut, what a scissor was, glue. If you finished writing, you could hold up your boards to show me. We need something to prepare these children because preschool and kindergarten are not mandatory. And the children are coming here and they weren't ready to start in September. You're all doing such a great job.
All right, boys and girls, today for our small group lesson, we will be working on the all word pattern, okay? Can you think of any all words? Raise your hand. Any all words we can think of, Kevin?
Ball.
Ball, can you think of one?
Tall.
Tall. Well, our program is a 20-session program. We do what I would say some preschools may take a whole year to do. We teach them everything they need to know to be ready and successful in kindergarten in September.
Small.
We work on social skills, we work on letters, sound. We teach them, you know, how to handle scissors, how to raise your hand, how to sit down. Basically everything they need to know, we're there.
This book for today is I
Lost something. We learned about the ABCs. My favorite thing was learning numbers.
He came with most of the letters, but no sounds, no writing, no reading. He came out of here from that 3 or 4 weeks, writing already. At his own level, but writing. It was amazing. It changed his life. He was ready for kindergarten.
Mrs.
Hall, how are you today?
Wonderful.
I feel that he's growing, and he's gonna keep growing. But of course, that's because of the teachers also. I feel that a program works if the teachers are great. Miss Santiago, Miss Rudolph, and Mr. A, they just gave the kids what they needed.
And it's that early step, that push that kids need to get to put them in the right place. And I am adamant about getting that. And I think if our program proves that, the hypothesis is that kids are showing what they're supposed to be doing, show that they can work harder, they can do more than that you're showing them, to give them that extra step.
Learned math and practiced reading. I learned how to write the numbers.
And we only do 20 sessions. Imagine if it was a whole year. Imagine.
That's really powerful stuff. So this program did a great deal for the parents and for the kids.
Yeah. Many parents were so thankful. We actually took a minute after the program was done to talk to parents about doing a survey, as well as just talking back and forth with them about how much this impacted their child. And they talked about the growth they saw. They talked about how their child was more confident. And that's what you need for a child to come to school with, confidence. And by the kids who do go to preschool, they already have that. I know my numbers, I know my letters. The kids that don't come in apprehensive, they don't even understand how to hold scissors, hold pencils, which we've seen. And for us, giving that to some kids that we can see about 20, 30 children and bring them into our classrooms for the school year.
How do you do that in 5 weeks?
For us, to do it in 5 weeks, the way we do it is, it's a lot of hard work. We take 4 teachers this year, 4 teachers, and give kids individual attention, as well as getting them into small groups, large group instruction, and then the best part of what we've done is that all of us have been trained in Tools of the Mind, which is a program that focuses on self-regulation. So self-regulation.
Self-regulation, what does that mean?
Yeah, it's a big word for a kid coming in, being able to finish one task at a time, also being able to manage their own behavior in the classroom, not shouting out, being able to finish any work or any task, instructions, primarily 3 instructions at one time, and carrying it out. So those are the things that we're trying to focus on for the beginning of the year. Readiness skills.
Kid, sorry for interrupting, is there a kid that you say to yourself, hey, this is a kid that I really see who has made a tremendous, you're shaking your head already.
Yeah, there's so many, but actually on the video you just saw one of them. I'll call him E, and his mother was on there too. He came into our school and he was so apprehensive about school. His older brother had come in, but this program, by coming in, by just working with a teacher that's in a seat in the year, which was me by chance, he ended up not only performing well, he became one of my best readers. And that spoke volumes to me. When he came in, he knew some of his letters, some numbers, but he just took off. And that confidence, that self-regulation piece, that just a child having that early step really made a difference.
Before I let you out of here, why do you love teaching?
For me, it's hard. I love teaching because it gives me opportunity to change lives. Instantly, every day I get to just step in my classroom and change a child's life and have them unlock something they didn't understand before, have them gain new knowledge. And I don't know what other career field I could do that in, but teaching gave me that, and it's been a gift ever since I started.
Were you born to teach?
I think I was. I didn't see it. I didn't actually know I wanted to be a teacher until my senior year of high school, when a teacher allowed me to skip a course to go into a teaching program. And by her giving me the opportunity, I was able to teach for the rest of my life. And
Gerry,
get
it was a
master's degrees.
teacher who gave you the gift.
That's it. And that's why I have to keep on paying it forward, because a teacher helped me. And if a teacher gave me that, I have to give it forward again.
Gerry Agyeman.
Yes, sir.
Congratulations.
Thank you so
keep
much.
Keep paying it forward.
I definitely will.
Thank you.
Thank you.
Great
Thank
job.
you for doing this.
That was great.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the New Jersey Education Association, the Robert Wood Johnson Foundation, Johnson & Johnson, Health Republic Insurance of New Jersey, County College of Morris, New Jersey Council of County Colleges, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
Not all County College of Morris students look like me.
Some look like me.
Or me.
Or me.
Or me.
We all come to CCM at different stages of life and for different reasons.
I plan to transfer to a university.
I'm training for a new career as a nurse. But we all know one thing.
CCM is where we want to be.
So check out the website.
Check out the website.
Check out the website.
And let CCM connect learning and your life.